Okay, we'll set it right here.
Yeah, that looked good.
Realtor Amy Chapman is making a lot of choices. As the new owner of Weichert Realtors Chapman & Associates, she finds herself deciding on the look of the new office. From selecting office furniture, to computers, to decorations, everything has to be just right. But no decision is more important to Amy than choosing a hospital that would meet all of the healthcare needs of her staff.
I did not think it was going to be this involved and this detailed and hard to, to get different opinions and information.
Amy's choice is the same one millions of Americans have to face, whether it's for a business or a family. Here in the Mid-South, you can choose from among plenty of hospitals, but that doesn't make the decision any easier. Fortunately, help is available.
Well, I would think the first thing that probably a patient should do is speak to their physician about hospitals. One of the first things we want to establish if their personal physician has privileges, is a member of the hospital staff and is able to practice at that hospital. In many cases, physicians are able to answer some of the questions. However, we find that patients may have to consult their health plan for coverage.
Dr. Drury knows the value of good communication between doctor and patient. And as Chief Medical Officer of a Mid-South hospital, his job is to stay up to date on the other resources available to consumers.
Greater than 90% of the hospitals in the United States are accredited by the Joint Commission for Accreditation of Healthcare Organizations. There is a number that you can call the Joint Commission to find if your hospital is certified. It's also available online through the internet.
There are also several websites that grade hospitals across the country. Now, it's not like these healthcare facilities are getting little gold stars. Well, actually, one site does give out little blue stars, but each site grades according to its own criteria. Take Hospital Compare, for example. On this site, hospitals are examined on 4 categories.
That's heart attack, heart failure, pneumonia, and surgical infection prevention. Heart attacks, for example, if the patient received aspirin when they first came in through the emergency room and were they discharged on aspirin. We really graded on what percentage of patients received those measures while they were hospitalized. And some of them are physician responsibility and some are hospital responsibility. So we know that by working as a team, the patient receives the best care.
And while your desktop or laptop can take you for a ride on the information superhighway, experts caution there are a few off-ramps you'll have to find somewhere else.
Unfortunately, we don't have any one site or one source of information which will answer all the patient's questions. I think that it's a combination of information that you gain from physicians as well as from websites, for example, on specific conditions.
Amy views any resource as a good source of information.
I absolutely did not know where to start on this, but I have friends and my sister's also in the healthcare industry and also have clients. So just networking with them and getting ideas where to begin is kind of how the process began.
Oh, and there's one more item on Amy's hospital shopping agenda, a road trip.
I would love for myself and my employees to see the facility, to see how clean it is, to see how it's organized, to see how busy it is, to see how the staff handles the patients.
In the real estate business, location is critical to long-term success. But in any business or any family, the location of just the right hospital is critical to long-term good health. For Smart Medicine, I'm Rod Starnes.
Joining me now is the Chief Medical Officer of Baptist Memphis, Dr. Richard Patterson. Dr. Patterson, thanks so much for joining us.
Thanks for having me.
Tell us about the quality programs we've been talking about.
Quality programs touch every part of the patient's experience in the hospital, actually. We look at everything from the efficiency with which we deliver care to the efficacy or the effectiveness of those items of care or those actions of care, and then past the hospital experience. So quality is an all-embracing phenomenon, and it's from the smallest to the grandest. It's from the beginning to the end. We're beginning to dissect out the entire healthcare experience and apply scientific standards to them so that we can measure them and find ways to improve.
Are all hospitals doing this type of thing?
Virtually all. There's a great deal of emphasis on this from every sector. For instance, Medicare has engaged 96% of the hospitals in America that take Medicare patients in a quality improvement program regarding heart attack and heart failure and pneumonia. And they're now expanding that to heart surgery and to joint surgery and to other experiences. So, I mean, it's sweeping the nation. It's huge.
What are some of the quality initiatives locally?
We have national affiliations through the Institute for Healthcare Improvement, for instance, in which we look at how we can improve our ICU survival rates. And we've had significant successes in applying these techniques that we've learned from others and that we have in part developed at our own campus, for instance, for the ICU patient, the most critically ill. So our survival rate has gone up significantly in our ICUs in the past few years. Our length of stay in ICU has come down. People are getting well more often and they're getting well more quickly. So,
are there other results we should be looking at?
As a matter of fact, I encourage everyone to go to cms.gov if they have access to the website, because there is a quality program through Medicare, and that's the Medicare site. And they'll help explain what the different metrics or the different measurements and the different phenomena are. And it's a great introduction.
Dr. Patterson, thanks so much for joining us.
Thank you.